Joshua, good afternoon. How are you doing today?
Good afternoon. I'm doing well, thank you.
Okay, so I came in to ask you some questions about phlebotomy. So walk me through a day in your life as a phlebotomist in Chem Health.
Okay.
When you get in, what do you do first?
My name is Josephine John, a phlebotomist at Chem Health and Diagnostics Center. First, when I walk in at Chem Health and Diagnostics Center, I make sure I sterilize my workspace.
So when you walk in and the customers start coming inside, how do you welcome them? What's the next step after they come in?
Okay, the next step, I open the door, welcome my patients, give them a warm smile, then with a sitting position.
Okay, so then I assume that what your role is to take their blood sample, right?
Yes.
So is there a situation where they get scared or get angry about taking their blood?
Yes, I've actually experienced so many of them. Most patients, when they walked in, they'll first of all tell me, hope your needle is not actually big. So I'll have to reassure them and calm them down to make them safe and relax.
Okay, so what was the impact of the needle being big?
The needle, most at times, the bigger the needle, the more the pain.
Oh.
So most at times, I do advise them, or I do tell them that I'll use a baby needle, that is the butterfly needle, which is less painful for them to feel safe and okay.
Alright, so when you take the blood sample, what next do you do?
I label my sample bottles, then transport it to the lab for further diagnosis.
Okay, so is there a different procedure for example, if somebody is coming for this particular test and another person is coming from another kind of test, is it the same way you take their blood?
It's the same process of blood collection, but it depends on the test. The tests that is being carried out determined the kind of how you're going to take the sample.
Okay, because there's a situation where my blood has been drawn from my wrist before, and there's one that has been taken from my fingertip before. So
that is the fingertips is when the tests are lesser. That is when it comes to like fasting blood sugar, when the patient is only doing fasting blood sugar or random blood sugar. But if you have multiple tests, that is when you can collect as much as you want through the vein.
Okay. Is there a situation where you don't see the vein?
Actually, yes. Since I started working at Chem Health and Diagnostics Center, I've not had difficulty in blood collection.
But it's possible that you do not see the vein.
Yes, it's possible. But so, once the tourniquet is being tied on them, the veins are always prominent for you to take sample.
Okay. What about, is it possible that you see the vein but there's no blood coming out?
Yes, it's possible. It's either you are tensed or you do not actually get the vein properly.
Okay. There is no situation that is because of the person. Maybe you're not eating well or you're not drinking water.
No, it's not possible. It's either you didn't locate the vein properly or you didn't put the needle where it's supposed to be.
Alright. Thank you very much for answering all our questions.
Thank you very much. Nice having you.
Thank you.